In the case of the ICD and CRT project, we were an important part of the health ecosystem, but not one that could look at all the different things that needed to come to the table to make this a success. We needed health economists, we needed CorHealth, we needed all the physicians, we needed so many different partners, including the Ministry of Health, to be at the table to actually look at the broader value chain for patients and to make sure that we were aligning all the incentives together in the right way.
Plexxus did a tremendous job of bringing the buyers, so the hospitals that were the actual users of the contracts, into the equation early and got them on side with the process. So everybody was bought in, right from the end user at the hospital to the vendor, and then Plexxus as the broker in between. And I think that was why this was successful, was because it was a well thought out process. It was a tested process through these vendor engagement meetings, and also the interactions with the hospitals, keeping them informed as to what was going on. So it was very much, at the end of the day, a project that everybody felt a part of.
So if we really reflect on important takeaways from this project as a whole, a couple really important topics come to mind. It does typically take a little bit longer than traditional procurement vehicles. And so really setting expectations about the time it takes to do upfront engagement well, and really have an opportunity to engage meaningfully with stakeholders before you kick off the process, I think is a really important consideration. Another element of our project that was incredibly important to our success was the engagement of a fairness advisor throughout our entire procurement process. Having a fairness advisor at the table when you're meeting with suppliers not only helps ensure that your messaging and direction is consistent across all those who are participating in the process, but also allows the procuring organization, Plexxus in this case, to really focus on conversations you want to have with suppliers as opposed to trying to be an arbiter of fairness at the same time. It was also really important to invest in governance processes up front. There are challenges that emerge when you have multiple partners at the table in terms of keeping project governance separate from procurement governance, and the latter has some very clear methodologies as to how we engage the hospitals that we work with relative to defining requirements and going through an evaluation process.
Savings obviously is a component of any sourcing strategy. You want to understand, well, what did you do from a savings perspective? But what made this process so important was that because we had everyone at the table and we were able to develop these system level challenge statements and look at value from the patient's perspective and estimate that value over their lifespan, we were able to actually impact real things that matter to the system and to patients. What this initiative was able to achieve was taking competitively the volume of Ontario out to market in a meaningful way, seeing savings and seeing sustainable device price moving forward, but not the lowest cost device, the highest, newest devices that can be implanted into patients that would last longer, have less negative clinical outcomes, and ultimately see a patient be healthy throughout their lifespan.